Hey, stop scrolling. Do you know diabetes can actually become life-threatening within hours? This condition is called Diabetic Ketoacidosis, or DKA. It happens when your body doesn't have enough insulin, so instead of using glucose for energy, it starts breaking down fat, producing ketones. These ketones build up and make your blood acidic, which can be deadly if not treated quickly. DKA is most common in type 1 diabetes, but it can also happen in type 2 during stress. And it doesn't just happen randomly, there's always a trigger. The most common ones include infections like pneumonia or urinary tract infections, missed insulin doses, heart attacks or strokes, certain medications like steroids, pregnancy, or even newly diagnosed diabetes. Now let's talk about symptoms you should never ignore. Patients often present with nausea, vomiting, and abdominal pain. They may complain of excessive thirst and urination, feel extremely weak, and develop deep, fast breathing. One classic sign is a fruity or acetone smell on the breath. If you see this combination, think DKA immediately. On examination, these patients look very sick. You'll notice signs of severe dehydration like dry skin and mucous membranes, a fast heart rate, low blood pressure, and deep labored breathing, known as Kussmaul respiration. In severe cases, they may even have confusion or altered consciousness. To confirm the diagnosis, we rely on investigations. Blood gas analysis will show a pH less than 7.3, indicating acidosis, and bicarbonate levels below 18. Ketones in the blood will be elevated. It's also important to check electrolytes, especially potassium, and look for any underlying cause like infection. Management of DKA is straightforward but must be done carefully. First, start with intravenous fluids. This is life-saving. Then begin insulin therapy to stop ketone production. But here's a critical point. Always check potassium first. If potassium is low, correct it before starting insulin. If it's normal or high, you can give insulin along with potassium as needed. And when blood sugar drops below 250, add glucose to the fluids to avoid hypoglycemia while continuing to clear ketones. DKA can be fatal, but the good news is it's completely treatable if recognized early. So if you ever see a patient with vomiting, deep breathing, and high blood sugar, don't ignore it. Save this video, share it, and follow for more real-life medical knowledge, because what you learn today might save a life tomorrow.